You don't need to be ripped. You just need the right shirt. Epic Fits gives you a clean, confident silhouette, snug on the arms, soft on the skin, generous where it counts. And with deals like $15 per tee, they won't break the bank. Visit epicfits.com today. Epic Fits. T-shirts that get it.
Okay, well, firstly, thank you for your time. I know it's been, a little bit of a struggle trying to get you here just because you were extremely busy. Honestly, every time I turn around, you're a guest on someone else's show or on the news, which is great. Showing that people are tapping into your expertise regarding mRNA, COVID, the effects thereof, etc. I wanted to go and read a little bit from your bio, if you're okay, that I pulled from the McCullough Foundation, since you are the administrator of the McCullough Foundation. And for those who don't know, that is, yes, Peter McCullough, Dr. Peter McCullough, which is really cool that you are working with him and you're bringing your expertise with you. So Nicolas, for those who don't know, I'm just going to read a little bit. Nicolas Hulscher is an epidemiologist, administrator at the McCullough Foundation, born and raised in Michigan. So earned a Bachelor of Science in Pre-Health Professional Studies from the Oakland University Honors College in 2020, graduating with institutional and departmental honors. You went on to receive a Master of Public Health, which, by the way, hats off to you. And so you specialize in epidemiology from the University of Michigan State of Public Health in 2024, and that's when you got your MPH. Is that correct?
Yes, that's correct.
And then what was really interesting to me is, you don't have a long career, but man, did you do a lot. Since 2023, it says here you did 16 peer-reviewed scientific studies, which included systematic reviews, original investigations, and case reports, which, significantly advanced the understanding of COVID-19 vaccine injuries, syndromes, and everything else that goes along with that. So I just needed to say that so people know who you are, or at least get a little bit of a background. So that's why I'm very happy that you agreed to be on the show, because it's like I'm talking to someone who actually has knowledge, which is great. So therefore, I want to start here because one of my friends who has another podcast, he's more geopolitics and stuff like that. He used to be an analyst for the military. But his concern was, in doing this with you, is he wanted an unbiased assessment and explanation of mRNA. Too often, it has been very politically biased, and especially from those in the medical profession. So that's what I'm hoping we get here. My political leanings and yours, regardless. I hope that we can get an unbiased explanation of what actually is mRNA. And I would like to start there because I think there's a lot of confusion, because we only found out about it during the pandemic, and that's when everybody became aware of what mRNA maybe, but we still don't really know. There's a lot of assumptions. Can you start with explaining that so we actually know what the heck it is and what we're actually referring to?
Yes, yeah. So when we think of vaccines, right, that's like everything that's been injected into our children, for the past many, many decades, about 100 years, over 100 years. Vaccines are, when you inject a killed antigen or killed virus or whatever, not mRNA. We're not talking about that. When you inject those killed virons or whatever, combined with an adjuvant, right, which is usually aluminum. Sometimes they preserve these with thimerosal, which is a form of mercury, or they used to. That's normal vaccines, right? That's it. It's just basically killed virus material, right? And so what happens with mRNA is completely different. mRNA is not a vaccine, right? They might claim it's a vaccine. It might be called a vaccine in the news. It might be called a vaccine by the CDC, but it does not work like a traditional vaccine. It is a gene transfer technology. It actually meets the definition of a gene therapy. Why do I say that? Well, because so how does it work? So let's start with how it works, right? So you have lipid nanoparticles, which are little bubbles of basically fat, right? That's what you could call it. So you have these lipid nanoparticles, think of them like bubbles, and inside of them is billions of mRNA, modified mRNA, messenger ribonucleic acid. These bubbles, once it's injected, travel to every single organ system in the body, including the heart, including the brain, including the bone marrow, and basically every organ system you can think of that's now been confirmed. Um, man, sorry about this. My cat is literally
That's okay.
throwing my camera around.
Hey, we're gonna leave it in because you're human, and we're our schedules have been tight. So the fact that you're able to sit down with me, I get it. But please keep going about mRNA, because you're saying that how it goes into the body and starts spreading to is it other organs and whatnot?
Yes, yes. So yeah, we'll continue from there. Yes, yeah. Sorry, the cat comes in. It's like we're talking very serious here,
I
about
know.
these catastrophic harms, and then
It's
we,
life.
yeah, that's what happens. All right, so yeah, so we talked about vaccines, right? This killed virus and an adjuvant to evoke immune response. Those are vaccines. Now we're on gene therapies, this mRNA technology, right? So we talked about the bubbles. The bubbles, lipid nanoparticles go into every organ system, and then once they easily get uptaken into cells, because the cells like this material on the outer coating of the lipid nanoparticles. So they kind of trick the cells uptake them, and then it releases modified mRNA, which then the mRNA goes into what's called ribosomes, these small organelles in your cells. It goes into these ribosomes in all your organ systems and instructs those cells to produce a toxic, highly pathogenic non-human protein, the spike protein. So then you have neurons, you have cardiomyocytes in your heart producing, expressing on the cell's surface non-human toxic protein. So what happens then? Well, then you have your own body's going to come and attack those cells, right? It doesn't want these foreign invaders. And that's why we see things like myocarditis. That's why we see endothelial damage, clotting. That's why we see many of these issues.
So is
And
this
so you
I'm
have
sorry
that
to
auto.
interrupt. I'm sorry to interrupt you, but is that literally what goes on then? Is the body's reaction to these mRNAs just trying to reject them as a foreign body, like it doesn't want it? Is that kind of what it's doing?
It's well, that's only one of the ways of damage, right? So yeah, we have the own body attacking the cells producing it, but then you have this literally toxic protein that will start to circulate in your body, circulate in the bloodstream, and deposit in vital organ systems. And this protein itself is highly damaging to tissues, and the body doesn't like it. It's a toxin, and so you have this circulating, and then you have DNA plasmids that are in these lipid nanoparticles from the manufacturing process that were not cleared out properly. And so you have spike encoding DNA, you have SV40 promoter enhancer, which they use at the factory to make this mRNA. And all this genetic material gets deposited. And we believe now we have many points of evidence. We have many studies now and many laboratory tests that indicate likely genomic integration of some of this material. So, yeah, these are not vaccines. These are dangerous gene transfer technologies, and they did not prevent COVID-19. That's for
Right.
sure.
So I'll ask one more question in defining this then. So you said earlier it was more intended to be a like a gene therapy or whatnot, or some kind of use for I guess changing the genetic code. Is that correct? Does it affect the genetic code of someone or anybody? I guess my question is, what was the actual intention of it? If it was intended for genetic therapy, what kind of therapy is that, and exactly what was the intention of its invention in the first place?
Right, right. So they claim that instructing your body to produce these proteins makes antibodies that will protect you from the virus. So that
Got
was their
it.
purpose. That's why they call it a vaccine, because they say the antibodies that you produce will, help prevent you from being infected. Like they claimed in 2021, they said you won't get infected. Now we have 8 studies that show an increased risk of infection. 8 studies, like these don't protect you; they actually serve as infection promoters. So yeah, so it's really a disaster, but it does not serve its purpose of protecting people from anything, unfortunately. And so, like they claim now, they've been making this mRNA technology for decades. BARDA in 2012 launched the ADEPT P3 program, where they wanted to make messenger RNA therapeutics, or what they call countermeasures against respiratory viruses or pandemics. And so they've been wanting to deploy this for a long period of time. And then, this situation in 2020 gave them that chance.
That's crazy. So it seems like they used the COVID pandemic as an excuse to actually test it on the general public. Am I correct in saying that?
Yes, that's correct. This was tested in animals before. It killed many of them.
So I'm going to ask you this, Nicholas, and I'm going to be respectful. So please, if you think I'm interrupting you, just tell me to shut up, because I've watched one of the other interviews you were on. And it's like you almost couldn't get a word in, and I felt bad for you in that situation. I won't say which one that was. But here, I want to start going through some of these questions because you defined it for us. Okay, so now we have a better understanding of that. But there's something else that's still a little fuzzy, because before, and this is something that I read. So again, we only can believe what has been told to us to be the truth, right? That's why we rely on people like you. So it's been said that before COVID that mRNA was like seen as a way to cure diseases, actually, and could also could be used as a way to cure maybe even all diseases. And so the question being is, does that still have is that still something that could be done with mRNA under the right circumstances? And could it then also possibly use for curing cancer? I mean, so I guess, was it used in the wrong context, when it came to COVID, or is there still something with mRNA that could be used for positive and curing diseases and maybe even cancer? Is that a truth, or is that just a rumor or propaganda or lie that was spread just to make us accept it?
Right. Well, I would say from the billions of doses that were now injected of messenger RNA technology and the catastrophe that has occurred, I would not trust this technology to work optimally without major side effects for any disease, unfortunately, right? We would think, okay, well, cancer, right? They're going to be investigating it for cancer. They're going to be investigating it for some genetic defects. They're going to be investigating it for muscular dystrophy. But the problem is that the technology is so it's not ready for human use. It goes to every organ system. There's no targeting mechanism, and produces an unlimited, undefined amount of antigen that it tells your body to make, and there's no off switch. And so you basically just inject these instructions for your entire body to start making foreign proteins. Now, for cancer, they might instruct it to make non-foreign proteins, which maybe would have a less side effect profile. But this technology has proven its failure for all infectious diseases. Now, as they move on to cancer and these other things, I don't have high hopes for it. It's been far too catastrophic in the harms we have detected now. It has dysregulated the gene expressions, thousands of gene expressions. A recent study we just put out did find that. This will probably be the case with even cancer mRNA vaccines. This will be the case when now they're pushing AI-generated cancer mRNA shots. It appears to just be another fraud. They like to push technology even if it fails. They make large loads of money from it. And I don't know, maybe I'll be wrong. Maybe all of a sudden, they'll develop a cancer cure mRNA injection. But
Well, it'd be nice to be wrong on that one, right?
Yeah. That appears to be a century away.
Yeah. So I have what you said earlier leads me into this. So with mRNA vaccines being pushed, there has been evidence that the mRNA vaccine in relation to being used for COVID-19, there is now evidence that it did lead to turbo cancers. Is that something that is a real finding? Is that true?
Yes, it's very real. Unlike what the media that's funded by pharmaceutical giants likes to suggest, they claim, they don't suggest, they actually declare that turbo cancers are a myth and they don't exist, right? So that's what they say. But there's actually 100 studies a literature review revealed this. 100 studies show there's about 17 distinct mechanisms that these injections may cause or accelerate cancers. And then a new study just came out, peer reviewed. First author Dr. Merrick, and it defines COVID-19 mRNA injection induced turbo cancer. And so this is literally, it's a cancer that kind of accelerates uncharacteristically. It wasn't seen before the pandemic, and then you have these cancers drastically spread at a very high pace that is just not normal. And these individuals unfortunately succumb to this cancer at a much faster pace than a classical cancer that may have been caused, by an environmental factor, long-term exposure to something. These injections usually, many of these people will have a cancer, right? Cancer in their body. It's kind of been checked by their immune system. And these injections go in, dysregulate immune function, cause immune collapse, and then you have this proliferation of their existing cancer into a full-blown turbo cancer. And so this is all biologically plausible. It's seen in the population level data. We see somebody named Ethical Skeptic. He does very great analytical work with the CDC data. There's been over 100,000 excess cancer deaths.
And you can contribute that to this mRNA vaccine.
Yes, this mRNA and spike, specifically actually the spike protein. Spike protein that induces appears to be carcinogenic. It suppresses tumor suppressor genes, so your body can't suppress them as well. And it literally impairs immune function. It appears to induce vaccine-acquired immune deficiency, or VAIDS. That's now evidenced by hundreds of studies. And so, it's not good. It's not good at all.
And so what do you say to those who were forced to take this particular vaccine in order to keep their jobs? And how much more damage were they doing to their bodies, in taking all these boosters, like 6, 7, 8, 9 boosters? Isn't that evidence in and of itself enough that this vaccine didn't even work?
It's clear evidence it was not working, right? At first, regulatory agencies claimed you only needed, one dose. Oh, just take one dose, or these 2 first doses, the primary series. And then all of a sudden they're like, oh, well, now you're going to need a booster. Oh, now you're going to need another booster. No, another one. And it just kept coming. And some people fell for this. They were tricked or coerced by mandates or false public health advice that was based on basically completely flawed data, basically made up lies, literally lies, actually, because they didn't know any of the true safety profile. You need about 5 to 15 years for genetic products. So to those individuals that took many boosters, the best course of action will be to don't take any more boosters. The more boosters you take, shown in a study by Shrestha and colleagues, means you have a higher risk of infection per dose, right? So if you get 4 doses, you're at like a 300% increased risk of infection. 1 dose was not nearly as high. So, you want to refrain from booster doses for sure.
So there are those who took these mRNA vaccines who feel that they felt worse, that they didn't actually feel better, and that somehow it may have affected their immune system because, all of a sudden they're getting sick much easier. They're getting, like common colds and whatnot that are much harder for them to get over. And, is that a side effect? Is that something that can be confirmed to be a side effect of the mRNA? And the other part to this question is, how can someone reverse the damage of the mRNA in the vaccine? Like, how can their body get rid of these mRNAs?
Yeah, so that's called post-vaccination syndrome or long vaccine syndrome. It's similar to long COVID, but it's induced by the vaccine. And so it appears to be much worse and longer lasting than long COVID. But yeah, so it appears that many of the symptoms from that stem from the spike protein, this toxic protein circulating in the body, causing microclotting, and so your blood not circulating properly, and many other different issues. And so, if you have this high burden of this toxic spike protein, you're going to want to clear that out, or at least help the body clear it out, because our body does not have any innate clearing mechanisms to get it out. And so at the McCullough Foundation, we identified 3 compounds. We do have a peer-reviewed study published on this. 3 compounds: nattokinase, bromelain, and curcumin. And these have shown in the test tube experimentally and in case reports to clear out the spike induced clots and even degrade the spike protein directly. And so that's what we have so far. That's what Dr. McCullough recommends to his patients who do have high levels of spike antibodies, which is the way of measuring it now. So let's go to that now. To know what your spike protein burden is right now we do use antibody testing as a proxy. And so usually, if you're over 1,000, then there are some risks, and you were likely either exposed to COVID or you got the vaccine. And usually those with the vaccine, another study came out, and there's a lot of studies coming out. Another study came out that showed vaccinated individuals have 7 times higher spike antibodies compared to those who just got the infection. So it installs much more spike. And so, yeah, clearing these out is critical. That McCullough protocol-based spike detoxification does appear to be a promising method. We do need to undergo long-term clinical trials, double-blind, placebo-controlled, to really assess its efficacy. But we don't right now. 80% actually, no, not 80%. 80% got the mRNA shots. 99% of the population has been exposed to the synthetic SARS-CoV-2 spike protein, either from the infection or from the injections. So the whole entire population was poisoned, and so we need to find answers as soon as possible, and we cannot wait years for these clinical trials. So, we do have to scramble for these solutions. And one other thing, for those who, feel terrible after their mRNA shot and they don't feel better, there's one key thing that needs to happen is you have to raise your vitamin D levels to adequate levels. Most are low. There's 2 studies now that show when you raise those vitamin D levels, it actually reduces or improves your symptoms if you have post-vaccination syndrome. That was one study. And the other one found it decreases severity of myocarditis. So what you really want to do is get sunlight, right, to raise those levels, because you get all the other benefits of sunlight. Thousands of them. Improves cellular function, improves mitochondrial function. So you want to get sunlight as your form of vitamin D if you can. But that is absolutely critical, right? If you're not doing anything, you want to pick one thing, that is something that is highly recommended.
Let's talk about the other concerns of mRNA and specifically how it affects our food supply. And there's a lot of questions as to whether or not mRNA is transferable. So, it's been used in various vaccines, specifically in our meat supply. So is that mRNA transferable? Like, will it transfer to humans who are consuming this meat? Is that something that has been studied? Is that something that can happen? And is it something that we should be cautious of or look out for?
This is completely unknown at this point because it's never been tested. But you would think they would test it right before they do such foolish things like this, but they don't test it, so we don't know. But I think it would be hard for the lipid nanoparticles and mRNA constructs to survive the cooking process. But again, we don't know. Now, since if these animals were injected with mRNA, they will be producing these toxic antigens. And so you would be consuming these toxic antigens. And, there is still a possibility, though, that yes, this mRNA could reach your circulation. We just have no idea. This has to be immediately tested. Now, what's most concerning about the injection of animals is the self amplifying RNA particle injections by Merck. They are already rolled this out. It's being given by vets all across the country to dogs and cats for various viruses. The most prominent one, including rabies, right? They recommend rabies vaccinations to basically all animals. And so now they have a self amplifying RNA one, and this one could most definitely shed onto human owners as it self replicates in your cat or dog, and they come and lick you, or you're exposed to their bodily fluids. This can probably reach your circulation, and then the self amplifying RNA will end up in your body and maybe even uptaken into your cells, and you will then also be producing rabies antigens. And so this is an absolute catastrophe that has to be stopped.
Okay, so let's touch on the viral shedding. How exactly can the mRNA vaccine, for example, let's say like a kid got the mRNA vaccine and they're around other people. So how can that be transferred to other people through viral shedding? Like how does that happen?
Yes. There's a study by Sue Peters and colleagues that found unvaccinated women in close proximity to vaccinated individuals outside of the household did experience an increase in menstrual cycle abnormalities, heavier bleeding, period delays, etc. They experienced these increased risks when they reported they were within 6 feet of these vaccinated individuals outside of the household. So that's all we have really for shedding studies. They haven't really bothered to conduct anything else, but we do know that the mRNA technology does disrupt menstrual cycles, and so when we see unvaccinated women experiencing these who are in proximity to the vaccinated, that does indicate shedding is indeed real, and it appears to be the case. Biologically, it makes sense because this. So likely, what's shedding is actually this spike protein in what's called exosomes, right? The body appears to encapsulate the spike protein in these exosomes, and these can likely be exhaled in breath, in saliva during sexual intercourse. This may be able to transmit. Now, the mRNA has been found in breast milk, and so for babies, for moms that are breastfeeding, this mRNA may be able to transfer to the baby via breast milk. And so there's many different routes of transmission, it appears, but again, no real more study has been conducted on this. They just continue to ignore it.
Okay, so regarding women, there's been reports. I'm not sure if these are verified or not, but um, how does mRNA or can mRNA affect a woman's ability to become pregnant? How does it affect their decision making and whether or not they should consider an mRNA vaccine or just not get an mRNA vaccine if they're planning to have a child?
Yeah, if you want a child, do not take an mRNA injection. It is very bad. We now have two new studies, recent studies that have come out. The first one was in rats, but what happened was they injected the rats with mRNA shots, and it literally wiped out 60% of their primordial follicles. So this is the egg supply of women that's non-renewable. It's that base layer they're born with. They don't get any more primordial follicles. The mRNA shots wipe out 60% of those, right? So yes, this was in rats, okay, but it doesn't matter. This is a living animal, and these injections are clearly extraordinarily toxic to the reproductive system. So, well, you might be thinking, well, is there human data? Well, yeah, there is. Another recent study came out, is peer reviewed by Manichi and colleagues. They found among 1.3 million women, they found that there was a 33% reduction in successful conception rate. So a 33% reduction in successful pregnancies in vaccinated women compared to the unvaccinated population. So we are seeing this in humans as well. So yeah, and then we have so many other studies that show risks during pregnancy. Study by Thorpe et al. Found, so many different safety signals looking at the VAERS system for pregnancy, including miscarriage, malformations, all sorts of issues during pregnancy as well. And we do also know another study came out that found the mRNA does transfer through the placenta of pregnant women, does transfer into the baby. And so if you are pregnant and you receive these, the baby will uptake Pfizer Moderna modified RNA, and it will be producing these toxic proteins, unfortunately. And so, yeah, these are not safe for reproductive health whatsoever.
Thank you for answering those questions that my friends and colleagues and even my wife had regarding mRNA and how it may transfer or affect humans or affect all of us. But now let's get to the questions that I am personally really interested in terms of the COVID response. So, with everything being said about mRNA and how it was not tested, how it has not been proven, can you shed any light on the organizations that were actually behind in pushing this mRNA vaccine during the pandemic, even though that it wasn't tested on humans and they more than likely knew that it was not going to be effective? Can you tell us who was behind pushing this vaccine, the mRNA vaccine, during the pandemic, during the COVID pandemic? And do you know for sure which companies were behind this?
Yeah, so there was many organizations involved. We have identified what's called the biopharmaceutical complex. It's a conglomerate of regulatory agencies, pharmaceutical companies, governments, and NGOs, these large nonprofit organizations. And it appears that this conglomerate is central to the approval of this, right? So the major nonprofits include, the Gates Foundation. We have organizations like the World Economic Forum. We have the Rockefeller Foundation. We have many of these foundations. We have the World Health Organization. We have Gavi, the Global Vaccine Alliance. We have CEPI, the Center of Epidemic Preparedness and Innovation. We have all these organizations that have been pushing this mRNA platform since its inception, funding their development, funding new mRNA injections, funding their distribution, doing all these key critical things. And you think, well, why did they do this? Right? Why did they do this? Why did the Gates Foundation, who literally thinks there's too many people on Earth and wants to reduce population, why would they care about saving people when they think we need to reduce the population? That makes zero logical sense that they would want to actually, save people. It literally doesn't make any sense. So why would they be very much invested in this technology? Well, it appears and actually, a large proportion of countries around the world deploy what's called population control policies or population control operations, where they actually employ policies to reduce population growth because they think they have too many people. This is real, right? For anybody that doesn't believe this, this is what countries do. We have China doing it, and we have many other countries doing it. And so this population control operations appears to have made its way into a global push with these mRNA injections, because now that we know what it does to fertility, now that we know what it does to birth rates, we are very, very concerned that part of the purpose of this rollout may have been population control related.
So, with that being said, and you don't have to answer this because I know I'm putting you on the spot, but how do you feel as an epidemiologist that the COVID response was handled at that time? And and with that being said, also, like, how do you feel about Fauci and how he handled that response? Because he was largely responsible for the push to get these mRNA vaccines out there into the public. And from what I understand, he even had a patent on his own at the time, or maybe he still does. Maybe you can correct me if I'm wrong there. But as an epidemiologist, what is your thoughts on Fauci and how he handled things? And I don't know, maybe if there's anything that you would have done differently, but what is your thoughts on Fauci?
Fauci has done many things that have broken the law. And we'll just say, obviously he's lied about gain of function research, lied under oath. He's facing perjury investigations, all that stuff. But regarding the COVID pandemic response, he advocated for lockdowns, for the closure of all the schools. He told us the mRNA injections were 99% effective. He told us we wouldn't get COVID with these injections. And so what appears to have happened is, as the figurehead for the pandemic response, he flat out lied to the entire population of these injections. And while also pushing completely flawed pandemic response policies such as lockdowns and masking and mask mandates and all this nonsense. And so the fact that he's still walking free from any persecution is quite shocking, right? Because you have his involvement with the Wuhan lab and creation of SARS-CoV-2 itself, as well as the mRNA injections. I mean, this is very bad stuff, right? This isn't something that most people could kind of walk around free after doing. And so what's now happened here in America is the Virus Law Group has actually filed criminal referral requests in 7 different states against Anthony Fauci and many other public health officials they're accusing them of murder, terrorism, abuse, racketeering, fraud for their actions and policies implemented during the pandemic, including these hospital protocols, suppression of early treatment, and all these things. And so there's just so many things to unpack with the pandemic response, but many of it, I think accountability is now, people are calling for accountability of specifically Fauci. But I don't know. We'll just have to wait and see.
Right. So how would you, I mean, you as an epidemiologist, you and your peers, it's always easy to look back and say, I would have done it this way, but how should it have been handled? How do you think we should have handled that?
Well, first of all, there should not have been lockdowns. There should not have been any lockdowns. That caused immense harm just by itself, right? Because you had people at home isolated, right? They weren't interacting with their friends. They weren't learning at school. They were just stuck at home on a computer looking at a screen. This was disastrous for the mental health aspect of the population. as well as the economic aspect. It decimated small businesses. It was horrible, and it didn't prevent anything, right? I mean, it didn't. Lockdowns will not stop anything from happening unless you keep something locked down forever, right? And that doesn't happen. Any pathogen will always find its way in. You might be able to delay it with a lockdown, but that's it, right? Once you lift these restrictions, it's going to come pouring in. So they're absolutely useless. Absolutely useless. Unless there is a zombie outbreak, okay, fine, I get that.
There's rumors
But
of
that's
that too,
about
though.
it. What was that?
I said there's rumors of that too, though.
Oh yeah, exactly. Honestly, they've probably developed pathogens in laboratories that could induce zombie-like behavior in people. That would not surprise me one bit, because there are thousands of these laboratories that are manipulating pathogens, and we don't know what's in many of these labs at all. So
I know we don't have a ton more time as we go on, but what you're saying really, it makes me ask this question here. When we're talking about the public health community and we're talking about other epidemiologists, why hasn't there been more people coming together to stand up against this and go after bad actors like Fauci, for example? And I'm only using Fauci's name because he's the most recognizable. I'm not trying to just zero in on him. But why aren't there more people coming out and speaking out against these bad actors that have these very bad intentions and how to handle the population and how to handle vaccines too? Which I got another question for you on that. But what do you think of that? Why are there not more people coming together and really chastising and saying, no, that's bad. This is not how this is supposed to be, and there does have to be justice administered based on their actions. They should be held accountable. Why are there not more people stepping up?
right. I think one of the reasons is people have just been demoralized, right? I mean, we've been hit with so many things now in the past 5 years. We've called for the removal of these shots. We've called for accountability. We've called for this and for that. And, it has led to nothing, right? The mRNA shots are still on the market, right? These people are still running around free. I mean, Fauci's running around free after clearly lying to Congress. I mean, you only need one brain cell. A kindergartner could tell you if they saw his statements here and his statements to Congress here. A kindergartner would tell you, yeah, he broke the law, and they don't face any accountability. So people are just tired. They're like, okay, they're never going to face it, and it's a sort of fatigue, it appears, that has incurred, and people just don't want to talk about it anymore. They've been demoralized, and to change that, I think what would turn the tide would be, finally at least one little drip of accountability, right? If finally at
Something.
least, yeah, just something happens. Something. Fauci, just for perjury, even though he's accused of many other crimes, at least one thing, and I think that would ignite a spark where people would finally, rise up again and start to call for true accountability.
Okay,
And
so
yeah.
so with that, I'd lied. I have two questions then, because you're sparking some, making the hamster run up here. Let's talk about this. And with the new Trump administration and RFK Jr. at the helm here at Health and Human Services, right? Do you think vaccine efficacy and how they're handled and standards of testing will improve, or has a lot of this just been window dressing or theater, just to get support and likes and whatever the hell it is that they need to look good to the public? Do you see a change from your perspective and through your work? Have you seen a change with this new administration and how vaccines are handled and the standards?
Most of what's happened so far seems to have been hindered by, political games, right? Yeah,
Right.
it does appear that most of this is, not enough actions being taken, not enough research is being initiated. Um, it appears that, they're staying in the bounds of what they think they can do politically, and And so, yeah, at my level, we're still researching the mRNA harms. We're uncovering crazy things that we would never have thought we would have uncovered. And the federal government hasn't done a thing,
Mm.
right? I mean, we're sitting here, they've been there for many, many months. This new
Yeah.
administration, we have not seen anything. We haven't seen them develop a test to look for genomic integration or spike in people. We haven't seen them develop therapeutics to help the millions of injured. We haven't seen anything tangible. We still see mRNA shots being allowed to be given to 6-month-old infants.
Well,
I
with that being said, Nicholas, what do you think about them trying to mandate these COVID mRNA vaccines to children attending school? Like it's supposed to be now a part of their regimen. I don't know if it passed because like the news cycle moves so fast. I hear these things. I haven't confirmed it because I've been talking to so many other people at different issues. Is that a thing that has passed? And what's your thoughts on it?
Yeah, so there are, I believe there are some states that were trying to pass that, and federally they did have the mRNA shots in the recommended vaccination schedule, but some schools actually did mandate it for attendance. Most of that appears to have gone away. Most schools, most places, you won't need an mRNA injection to attend anymore. But regardless, so actually in May, RFK did issue a directive to stop recommending them to healthy, little babies and healthy pregnant women. He did try at least do something, but it appears that like he can't really do anything, right? He did that, but they're still on the childhood schedule. All the CDC did was put a note that says talk to your healthcare provider. And then many of these healthcare providers are under mass psychosis still. They will still be administering these gene therapies to infants. So, we're in such a bad situation right now. It appears that whoever was HHS secretary really couldn't really do anything. We know RFK though, based on his, decades of what he's spoken about. We know he knows these are bad and dangerous and deadly. Even many of the childhood vaccines are dangerous. We know he knows that, but he can only. It appears he can only do so much as HHS secretary, and within
It's
an administration that still does like mRNA technology, he cannot act like a king. It appears as we wanted him to.
right. So, but what you're saying is what's sad when people fear it is it's still politics before people. It's backdoor relationships before the public, and that's
Right.
what we don't
Right.
want to hear. That's not what we're expecting. And I'm not trying to make this political, but with the change of the guard, with the new administration who ran on, hey, we're going to take care of this. We're going to look into what happened during COVID. We know that there's issues with these vaccines, and we're going to get right on top of it. RFK Jr., that is exactly what he said the whole time for many years, even before he came over to Trump's side. And it's not partisan because he's still a Democrat. So we can't pin this on Republican versus Democrat. There's something else going on that's stopping them from making the move and changing things. So it's good to hear what you're saying because from your perspective and working on the other side of things, you're doing these studies and you're like, yeah, but based on this, why are we still doing this? Like, it doesn't make any sense. You actually have studies that show there is harm, and yet there's nothing being done for the betterment of society outside of maybe implementing the policies and plans that you said earlier, which maybe this is just about population control. I don't know. One more question for you. And this has to do with newborns. And this is something that I've always wondered. Does a newborn really need the plethora of vaccines that is administered as soon as they're born?
Short answer, no. A human baby that is just been born, enters this world, does not need Merck and Pfizer and does not need pharmaceutical injections in their bloodstream when they're born. They just don't. It's dangerous. Actually, now the CDC is being sued for pushing an illegal and unconstitutional 72 dose hypervaccination schedule.
72 doses?
Yep, it's about 72 doses from birth to 18.
Jeez.
And so, yeah, and none of this was tested in combination. Nobody knows the safety profile when you give them together. It's completely unknown, and so
Hold on. So aside from just 72, they didn't even do any studies to see how they would interact with each other, these vaccines?
no, none.
What?
Yeah, they just assume, they've gotten away with it for
It's
so long.
ridiculous.
Nobody's questioned it, and they've just gotten away, and it's been fine. And so now that people are aware that this is the case, they're in they're going to face a lot of public backlash. That's for sure.
And these pharmaceutical companies, due to all these deals, like, you can't hold them accountable. They
No,
can't be
no.
sued. And what clause? Do you know why that is? Like, what clause there is in the justification for that? Like, why can't we hold them accountable? They know what they put together. You know what I'm saying?
Yeah. The 1986 National Vaccine Injury Compensation Act, that once that was implemented, that gave pharma companies liability protection, complete liability protection from vaccine injury from their products. So that's why you see before 1986, there was only about 7 vaccines given to kids, right? You didn't see that many autistic kids. You didn't see many profound autism cases where they needed, toilet assistance, etc. And then after 1986, when they got these shields from liability, you see the dose numbers skyrocket, into space, and they start deploying so many different types of vaccines for every virus they can think of, and they don't face any accountability due to this act. Now, Representative Gosar has introduced legislation to try and repeal this and finally allow people to sue vaccine companies when they're injured. And so there are legislative efforts underway, thankfully, to reverse this.
I know that's been happening in Europe. There have been cases where they've been going after these vaccine or pharmaceutical companies for harm, and we really haven't been doing it in the USA quite yet. So, yeah, it's a really sad thing. The vaccines in general, like you said, we don't need so many. 72 vaccine schedule, from birth through 18 is insane. I don't understand that. And they're not even testing how they interact with each other either. Like, and that's the one thing, watching the clock here. So you just initiated another very important question, because this is something that's come up in the past. Autism. So is there verifiable studies that links vaccines or the amount of vaccines and their interactions to autism? And if so, why are we not hearing about these?
Yeah, there's over 10 studies that do find an association between vaccines and autism. The most recent one's by Mawson and colleagues. It was over 40,000 Medicaid recipients, and they found pretty large increases in risk in those who received childhood vaccines compared to the unvaccinated children for many different neurodevelopmental disorders, not just autism, but tics as well as ADHD, right? And so we do have evidence of it, and HHS says there's going to be a report coming out, in September or October, where they're going to see. Where they're going to tell us if they found an association. I don't know, what they're going to come out with. But here at the McCullough Foundation, we are actually doing our own comprehensive study on this link between vaccination and autism. And hopefully that'll be completed within the next few months here as well. And so, there's been many studies documenting an association. I mean, you can find all of them on our Substack, thefocalpoints.com. We do report on them, and this cannot be ruled out.
So is it verifiable yet, though? As you know, like, there's been studies, but has it been verified that it is an actual link between autism and these vaccines?
An actual causal link has yet to be defined. Now, if I'm talking, now it appears that it's definitely, it can indeed induce autism in people. But I guess as an epidemiologist, we can't say based on the studies there that there's a causal link yet. But yeah, I mean, you have these parents, they go and get, they go and get their child the MMR, and then they bring them home, and then they have seizures, and then they're never the same since. We have so many cases of this. And so, yeah, when you inject toxins, large numbers of toxins, neurotoxins, aluminum, and you hyperactivate the immune system and you cause seizures, febrile seizures, and brain damage, it's not unexpected that you'll see these neurodevelopmental disorders.
So with all this being said, how can the public once again trust vaccines? Because there are good vaccines. There are vaccines that are proven to have worked. Or do you, in your opinion, are there any vaccines, like are all vaccines kind of bad in their own way? Do they all have a side effect, or are there really like, hey, no, there's good ones and we should use those and have them administered? So if that's the case, then how do we get the public to trust these type of vaccines that have been proven and trust vaccination in general?
Right. Well, yeah, some vaccines, could have contributed to the reduction in some infectious diseases, but actually, many of the reductions in infectious disease over the past 100 years were due to improvements in sanitation and care. And, some of it is contributed to some of these vaccinations. But the thing I want to say is none of the current childhood vaccines were actually properly safety tested is the thing, right? So none of them undergone long-term placebo-controlled trials. The follow-up time ranges from about 2 days for a lot of these vaccines in these studies to a few months. But yeah, none of them have followed these children long-term after administration. And again, none of them have been tested in combination. So we actually do not know the full true safety profile of these vaccines. And so,
For how long, Nicholas, should these vaccines be tested? Like, what's the length of time that they should be doing this study to determine the long-term effects of the vaccines when they're about to put out a new one or test?
Yeah, they should be following these children in these studies for years, right? They can
3 years, or like 3 years, 5 years. What do you recommend?
The longer the better, right? They should keep record of these children in these studies, and then keep them on record for about 10 years. That would be very helpful, and then they can publish another study in about 10 years documenting what happened to these children. But they don't. They just kind of lose track of them. All right, 2 days. We don't care what happens to them after that. That's what's happened, and so we just don't know what's happening to these children.
And for how long has that been going on?
Forever.
Really? Since the beginning of time?
Yeah. Yeah. I mean, the first vaccines were just injecting, like taking somebody's smallpox lesion and taking material out of that and then injecting that lesion material into somebody else. So that's what they were used to be doing. And yeah, now obviously that's changed, but
right. I guess my question is, like, for how long has this been going on where they weren't doing long-term studies on these vaccinations?
Yeah, well, for all the vaccines now on the market, none of them. None of them. There's not any proper long-term.
Can we give a defined date, like since 1988, 90? Or is there certain lists of vaccines, like certain vaccines themselves, that are kind of fall into that category of not being properly tested?
I'm telling you, there's a list.
I'm not trying to put you on the spot. I'm just wondering if there's something we could reference so that anybody who's watching, like if they did want to do this research, they can go, oh, okay, there's this list that I can look at. And, these certain vaccines, for example, they haven't been tested long enough or been out there long enough to really determine whether they're effective or what side effects they have. So that's what I'm trying to get at you. I'm not trying to, put you in a corner here.
Yeah, no. The list is on the Informed Consent Action Network.
Okay.
They have go to their website. They have a list of all the vaccines, and it shows you how long did they follow them up for. Was there a placebo group? And you'll see the list. It's all red boxes, which means they weren't adequate. And so that's what's happened with all of these. Now, again, in the past, like I guess in the 60s, 70s. I don't know. Honestly, I don't know if those were long-term or not, but, that doesn't matter at this point because the current ones being administered to everybody are not. right? And so we just have to.
What was the name of that website again, Nick? What was the name of that again, Nicholas?
Informed Consent Action Network, ICAN. If you look up ICAN, it should show up, and they do have a chart on their website that shows what's happening. I believe they sued the FDA for some stuff. They're a pretty good, decent organization.
Huh. Interesting. Well, I think we're getting to the end of your time with me. So why don't you tell everybody about the foundation, where they can find more information about you, the studies, etc.
Yes. You can follow me on X at NIC Hulscher. I will be posting basically every day. That's where you'll find all the breaking stuff. But in detail, if you want to see all these studies in detail and a full breakdown of them, you have to go to our Substack, thefocalpoints.com, and you will find it all there. You'll see Dr. McCullough's posts, author John Leake's posts. That's the place to go as well. And one more thing, the McCullough Foundation, McCulloughFND.com.
You got your cat there again.
Yeah. McCulloughFND.org. That's how you can visit the McCullough Foundation. You'll see our operations, what we kind of do on a daily basis. And we do need support, right? We do operate on donations and contributions. So, if you want to support our research, we've published over 20 scientific studies in the past 2 years exposing the harms of these shots where the government failed to do so. We're doing research on treatment protocols. We're doing all this stuff. So yeah, if you want to, consider supporting our work, please visit the website, McCulloughFND.org.
Awesome. Thank you for your time and the information. And hopefully we can stay in touch. I do want to possibly have you on again down the road as things develop. But again, thanks for your time. I know you're super busy, and I really appreciate everything that you've had said.
Thanks for having me.
Yes, sir. Thank you, Nicholas.
Honesty is the one way to